Topical fluoride effectiveness in high caries risk adults. Caries continues to be an issue in the United States for specific high-risk populations, including older and medically compromised adults. So we looked at three types of professional strength fluoride: office-applied gel rinse, office-applied varnish, and prescription 1.1% sodium fluoride. And we asked two questions. Are these effective at preventing new caries-related single-unit restorations or extractions as defined by only those that were associated with an ICD-9 or 10 code for dental caries in veterans at high risk for dental caries? And is there a dose response? This is a retrospective analysis of longitudinal data from 2008 to 2018 from the VA's electronic dental, medical, and pharmacy records. Our conceptual model required that all participants have 3 years of data available. 1 year is a washout period, 1 year where all fluoride use and caries treatment were assessed, and then 1 year to measure the outcome or any caries treatment following the year of fluoride placement. Our covariates were age, gender, race, ethnicity, the Salim Comorbidity Index, which is an index that looks at both physical and mental comorbidities, medication burden as defined by the number of prescriptions the patient took in categories, and the number of highly anticholinergic medications as noted in the Beers criteria. The number of dental prophylaxis appointments, the number of caries-related restorations during the index year, and the time between the first restoration during that time. We had 68,757 subjects in the study. The mean age was 59.2. They were primarily male and white with 3.7 physical and 1.3 mental comorbidities. They took on average 10.8 VA prescribed drug classes and had 3.9 caries-related restorations completed during the index year, and the patients had an average of 2.2 dental prophies during that index period. We looked at each of the groups as mutually exclusive, as you see here. So primarily the patients received varnish or gel rinse. We also had approximately 21% that did not receive any fluoride, and they were considered our comparator population. So the first question was whether receiving any of a specific type of fluoride decreased the patient's or subject's likelihood of receiving caries-related treatment during the next 12 months. As you can see, for varnish and gel rinse, the answer is yes, at approximately 30% less likelihood. So when we look at prescription fluoride, a different outcome is noted. If you see that prescription fluoride alone in the red on the bottom right had no significant reduction in this caries-related treatment. And when we added it to the other modalities, it did not help with the positive outcome. We wanted to identify if providing more of the treatment during a 1-year time period would decrease this likelihood of needing caries-related treatment. So for high caries risk adults, if you provided at least 2 treatments of professionally applied gel rinse or varnish, then you could decrease their likelihood of having caries-related treatment by approximately 30%. So for the maximum benefit for our patients, we need 2 or more treatments in a year. Looking at prescription fluoride either this way or in the last slide, it is not an effective preventive treatment in our high caries risk population. So what we're evaluating is the effectiveness of this treatment in clinical practice settings. And what we found is that in-office applied varnish or gel rinse decreased the odds of receiving caries-related treatment in high caries risk adults by 30%. A dose-related effect is noted, so for at least 2 doses per year is more effective than 1 dose. And finally, the use of 1.1% sodium fluoride prescription toothpaste needs to be evaluated or rethought because daily dosing discrepancies are currently out there. And we noted that at least 68% of our patients did not refill or use this as directed, and we know that a chronic condition requires continuous treatment. So patient and provider education to motivate continual use is appropriate. Thank you.